Welcome to FYI. For your information, I'm your host, Alvina Ali, and this is your weekly dose of community empowerment right here on Ramadan Radio Wolves on 87.8 FM. Now, every Tuesday at 5 p.m., we spotlight inspiring individuals, businesses, and organizations making a difference in our city. Now, if you're looking for support, want to get involved in community initiatives, or just love staying informed, this is the show for you. So today we have a special line-up. We're diving into the world of maternity care, support for pregnant women, and how families in Wolverhampton can access the vital services. So joining me in the studio are two incredible guests. First, we have Sunita Banga, the Equality, Diversity and Inclusion Lead Midwife at New Cross Hospital. Now, Sunita has dedicated her career to supporting pregnant women and families with additional needs, language barriers, and those seeking asylum as well. Now, she helps them across services in different languages and settle into Wolverhampton. She is also the winner of the EDI Award at the Royal Wolverhampton Trust Awards for 2024, was it?
Last year, yes.
Last year, right. Okay, so on top of that, Sunita independently runs a baby bank called Sharing is Caring, which helps vulnerable families get essential baby items. Also joining us is Dr. Paaryl Prinja. Did I say it right?
You said it right, thank you.
She is an expert in maternal health who will provide medical insights on pregnancy, key symptoms to watch out for, and how families can prepare for a new baby. Right, so ladies and gentlemen, this is going to be an informative and inspiring discussion. So let's get started. So Sunita and Dr. Paaryl, welcome to FYI. It's such a pleasure to have you both on the show. So how are you both?
Very excited to be here. Thank you for having us.
Lovely. You're welcome.
Yes, thank you very much.
Great. Now, first of all, Sunita, like I said, we mentioned the award. I want to congratulate you on that. How does it feel to be recognised for your work in supporting vulnerable families?
It's a real honour, to be honest with you. I was nominated the previous year, which is when I first came into post, and I was nominated and shortlisted. It was actually Dr. Paaryl that nominated me.
Okay.
Last year, I went through the same process again. I wasn't expecting to win it because I thought I've been here before. You get shortlisted, you get to the evening of the events, and then fortunately I did win it. That was a real surprise.
That's good, isn't it? Good on his arm. Well, that's truly inspiring. Now, let's dive into the information work that you do. Now, many of our listeners are pregnant women or families preparing maybe for a baby. So what kind of messages would you like to give out to pregnant women?
I think it's really important that people recognise what's normal and what isn't. And initially, when you have your booking appointment, the advice is always up until 16 weeks. If you have any concerns, to head to the emergency department. So that might include bleeding, it might include cramping, abdominal pain. If you've got severe nausea, vomiting, anything like that where you're becoming dehydrated, it's always to go to the emergency department.
Yeah.
That advice does change after 16 weeks. So we sort of skip out the emergency department and you can head straight to triage. Obviously, if you've hurt your foot or anything that needs the emergency department, do head in that direction anyway. But anything pregnancy related, we do signpost to triage. So by this point, we're more concerned about things like headaches and blurred vision, epigastric pain. That might indicate that your blood pressure is going up, increasing. Epigastric pain is part of that. You might experience that your waters break early. So a lot of people just assume they break right at the end when you're in labour, but they can break early. So that's a concern. If you develop any bleeding, even if it's pink or brown, we are suggesting that you should really contact triage and just get the correct advice. And if you experience any reduction or change in your fetal movements, so baby's movements, you normally develop a pattern. If you think it's less than normal, increased, or can't feel anything at all, always contact triage.
Okay. Yes, doctor.
I think the other thing I would say, really, to empower women and families really that have pregnant women, is if something doesn't feel right or you're given advice and you still feel uncertain, is to really challenge that and don't hesitate to come into hospital, ask for an opinion, and if that still doesn't feel quite right, to just voice that. I think so often I see women in clinic where they've been told something really well-meaningly, and it felt correct at the time, but still something doesn't feel right, and people don't feel confident speaking up. And I really, really would encourage women, if it doesn't feel right, speak up. If medication that you've been given to help you hasn't worked, do speak up. If you've been told about reduced movements, and you think, oh, it's reduced, but I don't want to bother anyone, please don't think like that. Do come in, do challenge, do get the advice and support that you need.
Okay, now that's really important advice there. Obviously, we know that pregnancy can be a joyful time for some. Now, you talked about some of the challenges and symptoms that women can face, and particularly to look out for as well. So, are there many families out there that want advice on how best to prepare for the arrival of a new baby? Sunita, if there is, what would you recommend maybe?
I think it's an assumption that only people who are pregnant for the first time, that they need more encouragement or advice to come forward. I think, even if you've had children before, each pregnancy is different, and you may experience completely different symptoms this time in comparison to previous pregnancies. So the advice really is for anybody. We don't think it's more pertinent to advise first-time mums, for example, over prime multips, we call them, when you've had multiple children. So the advice really is, if you're worried about anything, pick up that phone, contact triage, get in touch with somebody and get the correct advice.
Right. Okay, doctor, have you got anything more to say on that as well?
No, not really. I think Sunita really has covered it all, and almost a lot of women will feel embarrassed or not ask because they think they've been through it before. But actually, we're here for everyone. As Sunita said, every birth journey is different. Your personal circumstances may be different. Your health circumstances may be different. One thing we do know, and really that's why I'm in a job, because I deal with medical problems in pregnancy, is that we know that pregnancies can be complicated by, pregnancy-related issues, but actually a sixth to a fifth of pregnancies are actually complicated by medical issues. And that's a lot greater than it was sort of 10, 15 years ago. So, women that had babies 10 years ago may have problems today that they didn't have then. So that's also really important.
It's not one size fits all, really,
Exactly.
is it?
Yeah.
Okay. Also, is there any help available to people, obviously, who aren't English fluent at all? How can they access your services, Sunita?
It is a referral pathway from their community midwife. We've got posters all around the unit. They can also just drop in. So the sessions that I run, one of them is a group on a Monday morning. It's now called Baby Bloom. It's for everybody. So previously I had targeted Black, Asian and minority ethnic women. But I've lifted that as a barrier now, because it's it's for everybody. So I don't want it to be only for a particular group of women. So we do get people with different neurodiversities coming through now, learning difficulties. I've got people who are first-time mums, young mums. So anybody that wants to access the group, they can either self-refer themselves, so they can just turn up, or I normally get a referral from the midwife. So I normally contact the ladies, just let them, introduce myself, let them know what the group's all about. Some women come every week, some come just at the end when they finish working. They're now on maternity leave. Others come once, get what they needed from the session. They don't feel the need to come back. It's whatever works for the individual. So, and those sessions are available. I speak Punjabi, so if anybody comes along that needs to speak Punjabi or Hindi, I can get away with as well. Anybody, if I've had referrals, I've had a few Kurdish ladies, for example, come through, so I've contacted them and I've set a date. I said, I need you to come on this date because I'm going to arrange a face-to-face interpreter. So we'll do that. It depends on the languages, or we can use telephone interpreters when they arrive. So there's a variety of ways, but the information is available in different languages.
Excellent. Yes, doctor.
The other thing I would say is just really to empower women that they are entitled to an interpreter. Because often, I see women in clinic, and like Sunita can speak Punjabi and Hindi, but for women of other languages, they are entitled to an interpreter. So do say that, because some women will bring along family members to act as interpreters, and they may not always feel comfortable disclosing information to us that may be private through a family member. So that, you know, they're more than welcome to bring family members, but they are entitled to that level of confidentiality with clinicians through an interpreter. So to disclose it to your midwife what your first language is, and we should be able in clinic to at least arrange a telephone interpreter.
Yeah. We've actually got a word ski on wheels, or what we call the WOW device. And it's an iPad, and it's a not face-to-face, it's a video interpreting service. So we can literally dial in any language, and there's an interpreter available. So we've got a couple of those devices at New Cross, so we are utilising them.
Wow.
And the staff are giving really good feedback, because that's really helping with those communication barriers. And again, it's in all languages.
Oh, bless. Okay, really good stuff out there, really, isn't it? Times have definitely changed. So as a first-time mom, maybe, probably feeling really anxious, what sort of support is available for her mental health?
We do have a perinatal mental health service, so it depends if they've got a diagnosis. If not, we've also got different charities that we can access, the groups as well. We've got the Healthy Pregnancy Team. They do low-level mental health. There's the ACCI, which is the African Caribbean Community Initiative. So I've just started partnering with them, and they offer low-level mental health support as well. But generally, I think what we're encouraging women to do is ask for help, ask for the support. You know, you need to come out of your shell, really, start coming to groups, get some fresh air, talk to family, friends. And if they do need that additional perinatal support, that's definitely available. And that's a referral system.
Right.
And they can access the GPs as well if they need any medication. Paaryl?
No, Sunita covered it really nicely. You know, because she's got the real privilege of seeing a lot of these women and having one-to-one conversations directly about these issues. But generally, the things that I encourage women to do is to try and maintain good mental health, and absolutely the right thing to do is ask for it. But you know, things that are stressors, you know, to try and minimize that. Talking therapies a lot, you know, throughout pregnancy, because sadly we know, you know, after pregnancy, postnatal depression and postnatal psychosis, these are real issues. Other things that help are, you know, to try and make sure a really good support system is in place, but that support system that is one where the woman is in control, and she can sort of, you know, ask for things rather than being told what to do, which can happen a lot. Try and maintain, you know, exercise, you know, just even if it's walking 2 to 3 times a week, just to help that mental health as well, and feel less isolated, as well as all the groups that Sunita has outlined.
Is there anything that their partners could do? Or help them during or through their pregnancy?
Just be there, first and foremost. I think partners are the first person that will probably recognise when the pregnant person is not being herself. So you might notice a decline in the mental health. Some people don't want to talk to anyone. They stop going out. They stop bathing, washing. You know, they stop eating. They're not sleeping very well. So partners often notice that. I think you need some help. So even if the woman herself doesn't talk to professionals, you can have a lot of appointments during the pregnancy and afterwards too, your postnatal appointments. So dads are more than welcome to discuss issues with us. We're doing a lot of work in Wolverhampton regarding fathers, and we're really encouraging them to take an active role in the pregnancy. So it's that first 1001 days, which is pregnancy, and for 2 years afterwards. And obviously, you know, fathers are a huge part of that.
Oh, brilliant. Okay, now with regards to well, what I want to find out is what's new for parents to be in their pregnancy journey, so to call it. Are there any sort of changes in maternity care or is support that they should know about maybe?
We've got we've had some funding, so we've got the Healthy Pregnancy Team. So they're doing a lot of work with families regarding infant feeding, the stalk programme, smoking, reducing, CO monitoring, all those issues, just to try and encourage a healthy diet and lifestyle. So we've got that team there based at the Wolverhampton Wanderers Stadium.
Oh, yeah.
So we've got them there based there. There's the various groups that we run in pregnancy. We've got online antenatal classes, which are run by our one of our midwives, Nick Hawker. She does those, and that's a 4-week programme, so they can access them.
Brilliant.
If they want that face-to-face contact, there's my groups, which are weekly. And something that's brand new to Wolverhampton is what we call Dad Pad. So it's an app that's available on your phone. Anybody can download it.
Yeah.
It's not in the whole of the UK, but Wolverhampton, we have signed up for this app.
Yeah.
And it's for fathers, and it helps them navigate their way through a woman's pregnancy and into the child's first year or so. So it does talk all the way from how to support the mum, and it does cover mental health. It also covers a safe sleeping advice, infant feeding, even simple things like how to change nappies, bathing babies, as well as mums. Community first aid advice, choking, what to do if a child gets burnt, covers sepsis, how to perform CPR on a baby, for example, all the way up to child development and their milestones, reaching their milestones, so recognising what's normal. So also, in addition to midwives, we've got the health visiting service, so dads are really encouraged to really be a big part in the baby's life and the mother's life, and just be really involved with how to look after a pregnant person, the baby, you know, becoming a family unit. So we really are working hard with dads as well.
Okay, so you know the Dad Pad, when was that officially launched then?
Oh, I couldn't give you the exact date, but it's very new.
Is it?
I've got the hard copies here, but they are, it's a digital app. But for families that can't access that digital platform, we've got the hard copies as well. So if anybody would like a copy, they are available in the hospital, in the family hubs, in the groups that we're all running. So if you just ask for a Dad Pad, you can get the hardcover copy, or you can go to your app store and download Dad Pad onto your phone. And there's lots and lots of information on there, which new parents would find useful.
Brilliant. And is it available in other languages as well?
I think it's available in English at the moment. I believe you can change your phone settings to access it in different languages, but I will double check that before I confirm that for you.
Brilliant. Okay. You've also are involved in your own little charity, which is Sharing is Caring. Would you like to give us or our listeners a bit more information on how they can access your services and how you set it up and what was the theory behind it?
So it's just based on my community midwifery experience, really, just seeing the deprivation. I used to work in Birmingham. I saw lots of deprivation there.
Yeah.
Wolverhampton was different. We had lots of asylum seekers and refugees coming to Wolverhampton when I started working here, and we did definitely see a rise in people that were really underfunded or not entitled to any funding at all. So it's something that I just started just to see how it would go, really. So I'd not long had my own child. I just gave all his things away. Yeah. And then I thought, okay, that's gone now. What do I do? So my sisters had children, my cousins, you know, we're all of that age. Everybody was having babies. So it sort of started from there, but it's a referral system now. So it is a group that I run on Facebook only, just so I can manage it at that level. Midwives, I've had doctors refer women to me, social workers, health visitors, professionals can make requests. And it's a referral system, so they just let me know who the lady is, what she needs, and I contact her nearer the time of birth, what, you know, just to find out what she's managed to get together for herself, and then I try and fill in the gaps. So it's just to help with that financial crisis, really.
Brilliant. Just a quick one as well. You said you're on Facebook. Can you let our listeners know?
Yeah, it's called Sharing is Caring. I should have chosen a better name because there's lots of groups by the look out for an olive green wooden background, and there's a wooden sign in front that says Sharing is Caring. That's
brilliant. And I believe Dr. Paaryl, you want to come in?
I mean, I just think it's a fantastic initiative, and I know myself and colleagues have donated. So this is just a plea, really, to anyone out there or any local businesses, if they've got things to donate, nappies, blankets, feminine hygiene products, any sort of baby-related stuff. Yeah. You know, if they've had children themselves and they no longer need things, please, please, please consider donating it to Sharing is Caring.
Oh, thank you, Paaryl. I'm going to get an overload of
I hope so, because
now.
you know, you're absolutely right. You hit the nail on the head. We're seeing so many people in need, particularly with our newer asylum seeker population. But actually, the other thing that we've noticed in and around Wolverhampton is we're having a lot of women move up from London for social housing reasons from different communities, and these are women that have and families that have often had a real tight knit social support in the capital, and they're having to move out into Wolverhampton, and they just don't have that same support network. So we've seen lots of different communities now in our area, and we're just here to support everyone.
Yeah.
Brilliant.
And I think it's just our own Wolverhampton population as well. People, single parent families, you know, sometimes not both partners can work, and it's just generally just being struggling with finance. If you just let your midwife know, and she will do an assessment, and then she will send me a referral if it's warranted.
Brilliant. Now, if anybody out there wants to pursue your footsteps in becoming a midwife or a doctor, how would you advise them to go about it?
Do you want to go first, Paaryl?
Gosh, that's a big one. So I think the career as a doctor is hard. It is getting harder and harder, and things have changed a lot, and particularly working within the NHS has changed. But I think if you're really passionate about it, and you've done the work experience, and you understand what the job is like, and you're willing to put up with the negative aspects of it, then it's just a case of working hard, really hard, and just continuing to remember why. I suppose that's for anything really, is that you've always got to remember the why you're doing it, and that'll get you through the hard times. But it is a long old slog and a long career. But would I do anything else? Probably not. So very rewarding.
Yeah.
I can imagine.
I would second that. I think midwifery, obviously it's different from medicine. Our role is very much from the minute a woman becomes pregnant and guiding her through the whole pregnancy, the birth, and then postnatally. So I think if you really want to work closely with families, with women, and if you feel like you've got what it takes to help a woman along that journey, I think you have to really love what you do.
Yeah.
And if you're not passionate enough, it probably might not be for you. So definitely have a good think about if that is the direction that you want your career to go in. But if you're interested in midwifery or medicine, definitely pursue it, because we need you.
Yeah, we do.
Of course. Any advice for women who are pregnant during the month of Ramadan?
I think you might know more than me on this, Alvina. But my understanding is that it's your choice.
Yes,
so if
that's
you
right.
If you don't want to fast, there's no obligation to do so.
Yeah.
I will say I have met women who choose to fast. There's a lot of information and resources that are available online. We tend to support women whichever way they decide to go. So we meet women that are still feeding, they want to fast, or they've decided not to. So I think you need to look at your reasons for why you choose to fast, if you do, whilst you're pregnant or breastfeeding, and you just need to do it as safely as you can.
Yeah. Okay. Yes, doctor.
The other thing I would say is that for women who do have medical problems, certainly do discuss it early, your wishes. If if Ramadan is coming later in your pregnancy, how you wish to navigate it. It may be possible, but some support may well be needed. So do think about it early, and do ask.
Lovely. Right, we've just got under a minute now. I've got to say thanks to Sunita for coming in, and to the Dr. Paaryl as well. Is there anything you want to add before I close the show down?
I think one of the things I was really keen for our listeners to hear is that actually there are certain symptoms that we just take for granted in pregnancy, and think things like nausea and vomiting, that's just normal part of pregnancy. It's morning sickness. Yeah. But we see women become really unwell, and their babies be really unwell because they've had so much sickness in pregnancy. So it's just to make sure that they know that those symptoms aren't normal. And there is actually lots of help and medication that we can use in pregnancy. So do ask for it early. Don't put up with your symptoms. Similarly, things like breathlessness and chest pain and headaches. Yeah. These symptoms aren't normal in pregnancy, so do seek help if you do have those symptoms.
Lovely. Well, I've got to say a huge thank you to Sunita and to Dr. Paaryl as well for sharing their expertise and for all the amazing work that they are doing for families in Wolverhampton. Now, if you'd like to learn more or need support, you can contact Sunita through New Cross Hospital or reach out to her baby bank. Sharing is caring, and for all the new dads out there, don't forget to check out the Dad Pad, a great resource for navigating fatherhood, as Sunita said. So remember, FYI is here every Tuesday at 5 p.m, bringing you the best of Wolverhampton's community heroes, businesses and organisations. And if you know someone making a difference and they deserve the spotlight, let us know. Until next time, stay informed, stay empowered and stay connected. Take care.